So just some background, we've had lots more background than I imagined we would today, but Cambodia is a country with, in the 2008 census, was counted to have 13 million people. Median age is 21.9 years. But the population is aging now. There was a big surge after the end of the Khmer Rouge time in population regrowth because there was so much loss of population during that time. But now it's slowing down a bit, so the number of children under 15 is down to, in 2008, to 33% of the population. So it's not quite as 100% child as it felt like a while ago. The average family in 2008 had 4.77 people. So it gives us a flavor of the country. It's primarily a rural country. There's one big city, a couple of other smaller cities, but at least 80% of the people live in the rural countryside without access to things like running water, electricity, the amenities that are really comfortable and we're accustomed to in Singapore, but people don't have. And in Phnom Penh they have most of the time, but now and then we don't. Some more background. There's been a big surge in literacy. It's gone up about 10% over the last 10 years, which is quite fantastic. Infant mortality and maternal mortality have remained high, which is not good. This is in the first year of life. 60 out of 1,000 births do not survive. School attendance, as Cliff talked about, is, we talked about the percentages of children who go to school at all, but girls and boys enter at about the same level, but by the time they're in high school, only 38% of the class is girls, and when they go to university, that drops dramatically as well. And the health factor that too many children die of preventable diseases, as has been brought up in the other programs. This is a little girl out in Kampong Speu province, just picking at her rice, and this is probably her lunch meal, and gives a feeling for the outside of Phnom Penh life. Children die of diseases like diarrhea and pneumonia, which are not necessary to die of. But we don't have clean water, we don't have hygienic toilet facilities, and hand washing is considered a strange fetish of foreigners. So that kind of thing. So they laugh. They put the bowl out for the doctor when the doctor comes to wash, so that he can wash his hands. So this gives you a feeling because this gives you a background of how children live in Cambodia.